do a cuff management and also with the oral cares. So the first thing I'm going to do is check the patient's chart, gather any necessary items that I may need. If I don't have the cleaning kit, oral care cleaning kit with me, I need to make sure I grab the box of those supplies. So I always want to check, knock on the door, introduce myself to the patient, check the patient's ID band, and I also want to get the pre-vital signs, lung sounds, anything like that before I begin. So when I'm ready, I'm going to go ahead and get everything set up, make sure I have the appropriate PPE, gloves, face mask if I feel like I need to have a face mask while doing it. And then when I'm ready, I can go ahead and get stuff set up. So the first thing I'm always going to do is check the patient's size of their endotracheal tube, and also note before I begin doing any cleaning, cough management, make sure I know the lip level of where the tube needs to be placed at. So once I got that all figured out and everything's ready to go, I'm going to make sure I hook up my suction canister here to the suction meter, and then I always have it at -100, -120. Then I'm going to make sure I have my yanker set up. So I'm going to put that in like that, and then what I'm going to go ahead and do is I'm going to pull the sheath back here, and then I'm going to suction the side of the patient's mouth, the back of the mouth before I do any of the oral care. When I'm done, I'll shut it off, cover the sheath, put it in a protective area. So always when before you do any cuff management, you want to make sure everything's clean, nice and clean before you go ahead and do that. So what you're going to do with an endotracheal tube, so what you're going to do with this one, here I have the suction swab here. So what you're going to take is your oral agent, and what you're going to do is dip it in here. You're going to clean the sides of the mouth, around the gums, the back of the tongue. Try not to hit the gag reflex so that way they don't aspirate anything and all that. And with the suction swab, what you can do is you can hook it up to your suction and you can suction any of that excess stuff out. And you always dispose of it. And then the next thing what you need to do is moisturizer. So what you do is you would moisturize the side of the cheek, the gums, tongue, and also the lips. So when you're cleaning, usually they will have a clip where you can move the endotracheal tube from side to side. So always move it to the other side so you can get both sides evenly and nice and clean. And dispose of that. And if you notice anything that's not clean or didn't quite get all that gunk out, you can always go ahead and suction with your yanker. So the next thing I'm going to do after I got everything cleaned and I'm ready to go ahead and do my minimal leak test and an extraction test here, what I'm going to do is I have my 3-way here deal. And what I'm going to do is I'm going to connect this to here, a syringe here. And I'm going to have a meter that'll connect to one side and your cuff right here. So this is going to be what you're going to do is always when you're do your minimal leak test, you're always going to want to take your stethoscope and listen to the side of the patient to make sure when you hear that first initial leak, you'll start hearing a gurgle sound. So what you'll do is you're going to go ahead and slowly start removing the air from the cuff, and as soon as you start hearing that minimal or that leak there, then you'll see where you're at when you get that leak. And then when you're ready to do your obstruction one, you're going to go ahead and slowly push the air back into the cuff. And then when you hear that initial stop of that leaking sound, take note of where that is on the meter. So after you do that, always want to do a meter test with it, a pressure cuff test to make sure it's at the appropriate setting. So what you're going to do is put it on here, and so say if it's way too high, clear up on high, and it's too much, then what you do is you push this red button here and you can slowly move it down to the appropriate meter. So you want to have it in the green so that way the patient is not too much, so you don't want it too pressurized, so that way you don't cause any sores or any ruptures, anything in their trachea there. So when you're done and it's in the green, you're good to go. But always go ahead and check to make sure you don't hear any gurgling or any different sounds that may be affected by the cuff. And then what you're gonna do is get your post-vital signs, make sure the breath sound okay, check the lip level of your tube, and also note when you first came in where the endotracheal tube was sitting. If it was on the left side, move it to the middle so that way it's not sitting in the same spot it was before. And then I would go and remove PPE, wash my hands, and go chart on the patient's charts.